When it comes to emergency medical services, there's a crisis in greater Minnesota.
In some communities, if you have a serious medical event at home, there's no guarantee an ambulance or emergency personnel will get to you as quickly as you need. Chief Political Reporter Tom Hauser's live at the Capitol, where EMS services are asking for state financial help. Tom?
Yeah, Kevin, last year when the state had a nearly $18 billion budget surplus, very little, if any of that, went to emergency medical services. Now EMS leaders from across the state are asking for an emergency infusion of $120 million. Ideally, an ambulance will respond to an emergency call within 10 minutes or so. But few circumstances in greater Minnesota qualify as ideal. There are long distances to cover, and now a shortage of funding, along with workforce issues, making the emergency medical services problem even worse.
From rural towns to urban centers, the system is currently strained, underfunded, and at the brink of collapse.
Put more starkly, Mike Jutnan of the Minnesota Ambulance Association says,
a patient who's experiencing a heart attack, they can start to see their chances of survival plummet.
This comes at a time when we have an aging and medically needy population.
Becca Hipsch is the EMS director in Perham. Many emergency workers are leaving the profession because of low pay and inadequate equipment.
Ambulances are no longer able to cope, and I fear that without the support of the state, the network of ambulance responders around the state will collapse.
The biggest problem is low reimbursement rates from insurance companies and governmental payers. EMS officials are looking for an emergency infusion of $120 million from the state. The mayor of Virginia, Minnesota, says their EMS system lost more than $550,000 last year and covered it with reserve funds and investments.
It's not sustainable. In 3 years, we're not going to have any money in our accounts to pay for that.
And keep in mind, the city of Virginia EMS system covers 640 square miles. There are bills in both the House and Senate for that $120 million, but it could be difficult sledding given the fact that the state might have a projected budget deficit over the next 2 years, and legislative leaders have said they want to keep a lid on spending this year. Live at the state capitol, Tom Hauser, 5 Eyewitness News.
Tom, thank you so much.